Hi, everyone. My name is Maria, and we will get started in just a few minutes. We're just letting people on. Thanks for joining. And in the meantime, if you do want to introduce yourself, feel free to do so in the chat box. We'd love to know who is here. So feel free to share your name, if you're with an organization, maybe your location, and anything else you'd like to share. And thank you for joining. We'll start in a minute. All right. Yeah, I see some people starting to introduce themselves. Thank you so much for doing so. We love to know who's on and who's with us and where you all are coming in from. So while we are waiting for folks to come, I want to pass it to our wonderful policy intern, Kushi, who is going to be leading us through this webinar today and acting as our facilitator. You'll see me once in a while, but I'm turning it over to her to kick us off. So, Kushi, all you.
Thank you, Maria. Good afternoon, everyone, or good morning, good evening, depending on where you're joining from. Welcome to today's sales webinar in partnership with the U.S. Network to End FGMC, Navigating the System, FGMC Survivor Experiences, and Political Dynamics of Advocacy. As Maria mentioned before, my name is Kishi Prakash, and I'm a policy intern with SAO. Just a few quick notes before we get started. Today's session is being recorded, and the recording and slides will be circulated with all of you who registered. And the chat is open, so feel free to use it. And then we will also be dropping links in throughout the webinar for more information. So a quick safeguarding note, please be advised that today's webinar will involve discussions on female genital mutilation and cutting, which might include personal testimonies and discussions that could be triggering or deeply emotional for some participants. These conversations are important for understanding the complexities of FGMC and activism against it, but we recognize that they can also be challenging to hear. So, as previously mentioned, today's facilitators are myself. I've been a policy intern with SAO for the past year, and Maria Tahir, who's the co-founder and executive director of SAO, and she will also be introducing herself further in a couple of minutes. Quickly going over today's agenda of what you can expect for today's webinar. We will first spend the first 15 minutes introducing SAO's new listening session report. After that, we will have open discussion with 5 survivors of female genital mutilation and cutting who have engaged in or explored policy advocacy in the United States. Lastly, we will be introducing the new Policy Advocacy Care Fund, an initiative the U.S. Network to End FGMC is doing in partnership with SAO. I'm going to pass it over to Maria to introduce our new listening session report.
Great. Thank you so much, Kushi. And thank you everyone for joining as well, too. So I wanted to share a little bit about our report and sorry, I'm looking at some of the comments and about muted. If you all can hear me, please let me know correctly. If you can hear me clearly, if you can put it in the chat box. Okay. I think for who it's echoing, that might be on your end. It sounds like other people can hear. Great. Thank you for clarifying that piece. So again, thank you everyone for joining. We wanted to really talk a little bit about why we are holding this webinar and this listening session report that we created, and really the impetus for it as well. And part of that is Sayo has been involved in policy advocacy work for years, and me personally, as I'm someone who comes from a social work background, but also I'm a survivor of FGMC. I've been engaged in policy work, and I know it is not an easy thing when people who have lived experiences are able to engage and really try to share their story, their experiences, their knowledge with legislators as well too. And oftentimes we're doing so in a way that is not very trauma informed, or we're repeating those stories over and over again in a way that can be harmful. And so we wanted to know at SAO, and because we've heard from experiences from others who had lived experience as well too, and not just with FGMC, but others who might face other forms of gender-based violence, the challenges that come across when you are trying to pass legislation or endorse some sort of policy initiative as well too. And so we wanted to really understand, how can we support individuals who are engaged or who want to engage? Or how do we build up those support systems to be able to ensure more people can be involved in policy advocacy? What does that look like? And the first step really was to do a listening session with other survivors of FGMC and to understand what are the challenges they're facing and what are some of the recommendations or experiences they have had that have made this experience positive, if at all, as well. And so that's really what this report contains, that information, those conversations, the themes that we found from the conversations that we had. And this new report, which we're calling Navigating the System, Female Genital Mutilation Cutting, Survivors' Experiences and the Political Dynamics of Advocacy, really presents those key reflections and themes from the listening session, and it uplifts survivors' perspective on engaging in policy and legislative advocacy, with really particular attention to the emotional, structural, and political dynamics that shape these experiences. So, various discussion topics that we heard included sharing experiences within the legislative system, accessibility of these processes, and the types of social support that can enable more informed and sustained participation. And overall, the listening session really sought to just document survivors' perspectives on whether their experiences are met with respect and care, and to surface opportunities to improve how policy processes engage with and support survivors of FGMC, again, if at all, and more broadly, survivors of gender based violence. We really do believe the findings in this report can support others who are engaged in this process beyond those who are experiencing FGMC, and also recognizing polyvictimization or experiencing multiple forms of gender-based violence can be common, and recognizing that individuals might be engaged in various forms of advocacy. So we'll put the listening session report in the chat box, but just wanted to give you some context and understand a bit more about why we started this listening session and why we're hosting this webinar today. So I will turn it over to Kushi, who's going to share in a little more detail some of the key findings.
Thank you, Maria. So, based on the discussion with the survivors during the listening session, we pulled out 7 clear themes, and I'll be going into detail for each of these themes. So, the first theme that was prevalent was contextualization by identity. One common takeaway among these survivors was that policy engagement experiences were varied and really contextualized by the individual's identity. There were key differences like geographic location, race, and gender identity. And because of this, survivors had unique experiences informed by their demographics. One survivor stated in the listening session, quote unquote, "There's also the consistent fear of my advocacy pointing an arrow towards my community. Am I arming people who are hateful, racist, and who are going to use this as means to further marginalize?" Theme 2 that was prevalent during the listening session was the dehumanization aspect of the legislative process. Overwhelmingly, many participants described the experience of sharing their stories in policy settings as dehumanizing. The feeling that the process was impersonal was a common one, and one participant even described being treated like a puppet on stage. Theme 3 was the importance of survivor safe spaces and interpersonal support when working in the advocacy sphere. All participants share that the primary and sometimes most motivating positive aspect of policy work is getting to bond with other survivors and other advocates in the field. One participant stated, "I don't think I would have made it without the community that formed around me and the people that I've met and other survivors." The fourth theme touches on the political dynamics of policy advocacy. Participants repeatedly mentioned that policy advocacy is deeply shaped by political dynamics rather than solely by the urgency or moral weight of an issue. Many survivors expressed surprise at how much legislative outcomes were influenced by political factors such as party alignment, sponsorship, competing policy priorities, institutional relationships, and the timing and structures of hearings or meetings. One participant described it as it wasn't so much about the issue you were advocating with, or it was rather it was which side of the fence you were on. The fifth theme was gaps between testimony and actual influence that advocacy has. There were a few participants during the session who felt there was a limit to the influence public testimony provides compared to other forms of advocacy. Many described hearings as strictly procedural or performative, where there were limited forms of engagement of legislators. A participant mentioned that during testimony, most of them didn't even catch my eye. It didn't seem like they were paying attention. The sixth theme prevalent during the sessions was the emotional tolls built into the system. Participants described that policy advocacy requires a significant amount of emotional labor due to the repeat nature of retelling the same traumatic experiences in environments that are not always respectful or responsive. Many participants described experiences with legislative staff or other political workers and described experiences of disbelief, dismissiveness, or a lack of attention from these policymakers. Lastly, theme 7 was advocacy as skill building and learning over time. Finally, participants explained that political advocacy is an evolving learning process. Many stated that their knowledge of political systems, strategy, and effective engagement developed gradually through experiencing advocating through the system, as there was a lack of structured guidance when they first entered the advocacy spaces. As a result, much of their understanding of policy processes and effective engagement strategies were developed through trial and error. One participant mentioned that there's definitely a hidden curriculum when it comes to policy advocacy. Based on the themes and insights gathered during the listening sessions, the following recommendations are presented to improve the experiences, accessibility, and support for FGMC survivors engaging in policy advocacy. These suggestions were created in aims to promote more trauma-informed and transparent engagement practices across legislative processes in the U.S. The first recommendation is better preparation to enter the policy advocacy landscape. Processes could include the development of accessible orientation materials, or guides for new advocates that outline what policy engagement typically looks like, including potential emotional, procedural, and political dynamics. Second, participants frequently described experiences of dismissiveness or lack of responsiveness in policy spaces, highlighting the need for greater awareness among legislators and staff. Providing educational materials and guidance to legislators could help strengthen respectful and responsive engagement with their constituents. Next, creating opportunities for a camaraderie across the policy advocacy sphere for those who have been involved in policy advocacy can only strengthen their resolve to remain engaged in policy advocacy. Building community is what allows these individuals to create change and sustain change. Additionally, reducing structural and logistical barriers such as geographical location and timing allows participation to be more accessible. Lastly, clarifying how political institutional processes shape outcomes can help set more realistic expectations and support more strategic engagement for these advocates. Now we will be having a discussion with today's speakers, Isatu Jeng, Dr. Muna Osman, Dr. Renee Bergstrom, Zara Patwa, and Simanesh Kamalasi. Thank you all for taking the time to be a part of today's conversations. And for those who'd like more information on today's speakers, please refer to the speaker document that will be pasted in the chat. So starting off as an introduction for all speakers, I'd like to ask, could you share your background and share what experiences you have in engaging in policy work when it comes to addressing FGMC? Additionally, could you share a few examples? I will ask Sarah to go first with this if possible.
Yeah. Oh, sorry. Trigger happy on the video there. Good morning, good afternoon, good evening, everyone. Nice to see so many people here from all over. My name is Zara Power. I have been an activist wanting to end FGMC since about 2015, a little before that. In terms of policy advocacy work, so I am an activist. I'm a survivor. I think that has been, core, but in my career since, for the last 12 years, it's been incredible. There's how many people who are not survivors have been amazing allies and really push forward. So really, thank you to everyone for being an ally. It's not just survivors; it really is, everyone that makes this work. So my experience with advocacy, I've had some in India. We're trying to bring about an anti-FGMC law in India. So that has been going on for about 10 years now. That is still going. It's a very different system to the US system, but a lot of the same things in terms of, testifying and educating and that kind of thing. I've testified at a couple of different states. Washington State was a fairly quick one, and that was a somewhat pleasant experience. I also live in Connecticut, and I have been quite heavily involved in getting the Connecticut law passed. So thank you to the Connecticut Coalition to End FGMC. You've been phenomenal. So the law was passed earlier this year, so that's fantastic. There has been, aside from the testifying to the legislators directly, a lot of education, a lot of sharing my experience over and over and over again. So that's mainly where I've been doing a lot, and then coalition building too. And I'll talk about that a little later on as well. Thank you.
Thank you for sharing, Sarah. Izatu, would you like to go next?
Yeah, sure. Thank you, Koshi. Hi, everyone. Been trying to put my camera on, but you see, the integrated camera is blank and the external camera is not working. So I'm sorry. I apologize for that. Yeah, but glad to be here and thank you everyone for joining us today. So I am Aisatu Jeng. I work with the US NFGMC network as the training and technical assistance coordinator. Manager. Yeah, I am born and raised in the Gambia. So in terms of my work in policy advocacy, in my capacity at the US NFGMC network, it's more about designing and organizing training. For survivors, and on legal landscape and policy advocacy. Empowering survivors. So more about training and technical assistance, but there have been an occasion where I've shared my story. So more about providing training and training and technical assistance to survivors on legal advocacy. So I've been in the movement to FGMC for over 15 years, more in the Gambia. So I have contributed largely in political advocacy in the Gambia. I have been part of people who have, contributed a lot in advocating for a law in the Gambia. And we had a law in 2015 against in the Gambia. I have testified in so many settings in the Gambia. And so most of my policy advocacy work has been in the Gambia, compared to the US. But yeah, so I've been in this work for quite a long time, like over 15 years. So, aside giving public testimony, also work at grassroots and community level. Training survivors and community, members, to advocate for, the enforcement of the anti-FGM law in the Gambia. When we have law 15, we also made effort to educate people about the law and also legislators on how to, better listen to survivors, and also how to better enforce, the law, and also law enforcement officers in the Gambia. So basically, that's a short. That's a short. Introduction of my policy advocacy work on FGMC.
Thank you for sharing. Renee, would you like to go next?
Yes. Thank you all for joining, and hello from wherever you are joining from. I am a Midwest American survivor advocate, educator, and artist. I started my advocacy in 1981, but became much more active in 2016. I serve on Sahiyo's advisory board, and my Sahiyo Voices to End FGMC video was shown to US legislators. So thank you.
Thank you, Renee. Muna, would you like to go next?
Hello, everybody. Hi there. My name is Dr. Muna Osman. I'm doctorally prepared nurse practitioner. I am a resident of Washington State. I am a two-time survivor of FGM. That's how I became involved when I did my education. I started digging more, and I realized that the problem started back then, still continued. So I got involved in a community level, not only as a member of the community, as an educator, as an advocator, and as a healthcare provider. I realized that there was a gap. FGM was perceived as the over there problem, and when we have high constituents of people who live in the city who struggle with it, and no education, doctors don't know about it. So I decided to get involved. I started that work in 2012, and I'm still doing it. I am a co-founder of Washington State Coalition to End FGM. I was a member of the group who helped pass SB 5453. I am an educator on the ground. I go to communities. Sorry, that's the phone. I go to the communities. I teach 101. I do support group. I build that trust so I can be a resource for them. I work with nonprofit organizations in the community to advance that work and get to also providers. And we educate healthcare providers, especially primary care, pediatrics, because then they are they come and encounter and they don't know what to do with the information. They don't know what to do with how to help the community. So we go in and educate as much as we can, and we support and we create resources. And that's how I became involved with FGM.
Thank you
Thank
for
you.
sharing. Our last speaker, Simonesh, is running a bit late, so we'll have her introduce herself when she's able to join. But we'll move on to the next questions. So starting off, what forms of advocacy beyond public testimony can be meaningful and effective? Renee, would you like to go first?
Okay. I share my story with second-year students at the Rochester, Minnesota and Scottsdale, Arizona Mayo Alex School of Medicine, followed by an in-person or Zoom half-hour Q&A. The students are very attentive and ask meaningful questions regarding appropriate responses to survivor patients. I send updated resources each year, and including my story as part of the Without Exception Films Unmuted series that has been shown at the medical school. Another audience was Mayo Clinic OBGYN residents. I believe doctors throughout the world need to be educated on the ramifications of female genital cutting.
Thank you for sharing. Moon, are you okay to also answer this?
Can you repeat the question for me, please? Sorry.
No, it's okay. What forms of advocacy beyond public testimony can be meaningful and effective?
I think media, we underuse media power, and I see a big gap. And we have Sahiyo, sharing the stories, but again, we can go in a bigger caliber using the media, because media now go to every house, to every hand. Everybody have a phone, and I think talking and um, bringing up why it's important, why it's not a foreign or a global issue. It's a local to global issue. It's affecting so many women, so many families. I think social media is one that we use in some, but we need to go harder on.
If I could just jump in there, I love, Mona, that you mentioned media as well too, and I'm wondering if maybe Zara, I could pull you in just to talk about how media was used in Connecticut as well and throughout the years, if that works.
Yeah,
Sorry,
absolutely.
Maria, before Zehra, I'm sorry.
Sorry, go ahead, Esther.
Shaminis is here. She used my link to join.
Oh,
Yeah, so she wrote
wonderful.
in the comment that she's here. So
Great.
Oh, great.
the other Isa Tijang is Shaminis, okay? So you know. Yeah.
Well,
Great.
I'll
Simonish,
answer quickly, and then we can have Simonesh because yeah,
perfect.
I'd love to hear from her. So yes, we did use we did there was a lot of media coverage of the legislation process in Connecticut over the 6 years that it took, and it was a lot of storytelling. There was both there were TV coverage, also written articles, radio, that kind of thing. I think it feels like you're constantly repeating the same thing over and over, but you really need to keep doing that in different forms. Or we would make videos on social media, or we would have discussions with legislators outside of the actual session. I think all of those things kind of add up to making the message more understandable to as many people as possible. So I think Mona, you mentioned social media. I would expand that further and say media in general. Really having we were blessed to have reporters that actually came to the some of the sessions, but it was the discussions afterwards that really kind of brought home the story and really made it compelling for people to read. There was a story about Simonesh actually after one of the sessions we had in Connecticut, and it was really moving. And people actually reached out to me and said like, "Hey, I saw this." I mean, my name was further out in the article, but Simonesh's story was so compelling, and so seeing that in different kinds of media, I think is really helpful because it just kind of adds on and reinforces the message. So, but I want to pass it on to Simonesh now she's here. So.
Yes, Simish, would you like to share your background and share any experiences that you have engaging in policy work, just as a quick introduction?
Yes. Hi, my name is Manish Pomolo. I am from Ethiopia, and so I've been here about 15 years. The first time I heard about FGMC and the contact of the US was when I was working as a human trafficking specialist. I somehow end up in a webinar that was done by Sahiyo, I believe, and as well as the coalition in CT. So since then, I've been continuing to learn about FGMC. I've become participated in testimonies and also went to like a SAO organization that was done in Washington, D.C. for the voice, just to share my stories. Like Zara was saying, like I've testified, I've written a story. I've just been very much several times, I think the past 3 years, just use my life as a testimony of to see what it is and how it could bring some change.
Thank you for sharing. We can move on to the next question is how can findings from the listening session report, in your opinion, inform future FGMC advocacy efforts at both the state and federal levels? And Izatu, would you like to go first?
Sure, Kushi, thank you. So, as it is suggested in the listening session report, I believe that future FGMC advocacy at the state and federal levels, should move beyond relying primarily on survivor testimony and, adopt a more survivor-centered, trauma-informed and strategic approach. I believe us as survivors should be engaged as policy leaders and partners in developing these legislative priorities, rather than being asked primarily to share traumatic personal experiences. It shouldn't stop there. It should go beyond there. So I believe as advocacy organizations, we should prepare survivors and provide training, as I mentioned earlier, like SAYO and the US network are doing, to provide training in legislative processes, also in relationship building, in coalition development, as mentioned by Zahra and other people, and also political strategy. So at state and federal levels, advocacy should also integrate survivor voices with relationship building, as I mentioned, policy research, coalition advocacy, and also legislative briefings. And this should be sustained engagement with policymakers and staff. It shouldn't be one-off. This should, be a continuous thing. So, and also the finding has shown that political factors, including party alignment, legislative priorities, sponsorship and timing can also influence policy outcomes as much as testimony itself. So both testimony, providing testimony and also all the other, things I've mentioned should go hand in hand. So I believe policymakers should also receive trauma-informed training. That's super important. So survivors, so that survivors are treated with respect when they know how to engage in trauma-informed. When they receive, I believe when they receive this training, they'll be able to treat survivors with respect, and our participation, shouldn't, will not be seen as just, our participation does not cause unnecessary re-traumatization. So when we are treated with respect and dignity, we won't, that will, reduce or stop and the re-traumatization that, some of us go through as highlighted in the report. So lastly, I believe the findings, looking at the findings also, support and advocacy model, as highlighted in the report, values lived experience while also ensuring survivors are supported, prepared, and not expected to repeatedly relieve trauma to influence policy. Yeah.
Thank you. I think that was extremely informative and extremely important too. Siminesh, would you like to add on anything?
So what was the question again? What form of advocacy beyond public testimony can be meaningful?
No, the next one. How can the findings from the listening session report inform future FGMC advocacy efforts at both the state and federal level?
Maybe just for the report to help identifying gaps in the laws, services, education, support for survivors. Yes, lived experience is important, but it's also at the state and federal level, like finding like advocacy and like policymakers and understanding where education resources, come from. I think is very important. I believe like survivors needed a meaningful role in shaping the conversation, helping determine like what effect changes and looks like. So I believe that I think just the gap in the research and like understanding more about what FGMC is.
Yeah, I think that's extremely important too to understand. Thank you. Moving on to the next question. What should legislators and other policymaking staff understand before hearing testimony from survivors? Zara, would you like to go first?
I would. So I just want to start with a little story. I had testified in a couple of states remotely, and had said my speech and everything was great. I then testified in Connecticut, which is my home state, and the whole experience left me very, very emotional, very upset. And so I vowed to make sure things were better next time. But there's a lot for legislators to understand here that there are people who will be testifying who are traumatized already, that they should not be traumatized. That sensitivity that's talked about in the report is so important, and asking the right questions in the right way, not making assumptions, those are really, really important. Like, keep the questions open as opposed to just very concrete. And having empathy for the person who is testifying. It is very hard in the 3 minutes you get when you're testifying to say everything you want to say. And we work really hard to make sure that, what we're saying is really concise, but it's hard to really bring the nuance into that. The one question we get asked all the time is numbers. What are the numbers? How many girls are impacted? How many women are impacted? Well, there are numbers out there, but the numbers aren't as important. I started saying, one girl cut is one too many, because it's true. It's like we should focus on the harm that this practice brings, not focus on how many people are suffering. We don't say, oh, well, we only have 10 murders this week, so therefore we don't need to make murder illegal. It in itself is wrong and should be made illegal. So that kind of goes along with FGMC there. So I think focusing less on the numbers and more on the harm to an individual. I think that if legislators understood that, I think that testimony better. I really do think that will help them kind of move away from, okay, this thing impacts 10,000 people and this thing impacts 2,500 people, which is more important. It's not an apples to apples comparison there. The other thing I would say too is to legislators is to focus on the practice, not the community. So I think, as people have mentioned before, people along their party lines, they're constantly thinking about, I think this because that's what my party thinks. But we really need to separate out the practice from the community, because the community will still sustain. That will continue. We're not saying that, this community or that community, because they do this one thing, should be eliminated or should be, made illegal. Like that's not what this is. There is one practice in this community. The community must be respected, but this one practice can be made illegal. So I think it's making sure that legislators focus on the practice that people from the community are saying is harmful and needs some legislative action, rather than kind of denigrating the whole community.
Thank you. And I will be asking a follow-up after, but I wanted to hear, Muna, your thoughts too before.
I agree with everything Zara said right there. I think also when we look at the legislative side, they don't have information. They didn't hear about it. Why it's a big deal now. So again, I'm seconding her. We need to be empathetic. That's what we do as a legislator. You working for this constituent too. So empathetic, ask question, but again, refrain from asking traumatizing questions or acting like it doesn't matter how many. Um, but again, we need to make that education, training, teaching. Like I said, as we get these stories out, because one of the questions I got second to how many, it is how's that different than boy circumcision? That's another one. And not everybody of the community who's testifying able to answer that question. And we need to do more education, more talk like that so they can see that the everyday constituent who's coming to testify for something happened. It's one issue, but it's a practice. We're talking about the practice that they don't have that capacity behind them, and it make everybody re-traumatized, frustrated, feel like oh they did an awful job while they came here, and refrain them from coming back again or doing any work in the out. So I think the more education, the more understanding, empathy, sensitivity, cultural appropriateness. These people been through traumatic events and they don't need one more, and they don't need to be feel like okay, I don't matter. Okay, I'm one. I can't do anything. So I think that's the bulk work we do, actually answer these questions and do the education. But I agree totally with what Sarah said. And I'm adding, we need to get them, to let them know, reach them. Like I said, in media or whatever forms we have, we don't have. We dealing with the problem. We are far stretched. Like in Washington, in Connecticut, in Boston, in New York. But again, we do not have that one force to communicate directly with these legislation and have that relationship and ask the questions. So they take that opportunity of that 3 minutes to get their education. Thank you.
Sarah, did you want to add something?
Yeah, actually, it was just to jump off something that Mona was saying about empathy. Yes, the legislators absolutely need to be trained to be sensitive and have that empathy for survivors and allies who are testifying. It also works both ways. In Connecticut, legislators are part-time. So they're being pulled in lots of different directions. So it's important for us to understand that they have limited time as well, so that when we're preparing for our testimony or our advocacy, that we understand that we're not taking up too much time, because they don't have that time. So I think it works both ways. They're very different kinds of empathy, but they're trying their best. And clearly, it met so many legislators over the 6 years. They have been really caring and really trustworthy. But when you get to the session, it's like it looks like they don't care, but it's not that. It's that they've got 100 things going on. They're part-time. They have a job as well, so I think it helps for us to have empathy for their situation as well.
That's
Thank
a
you.
very good point, and it kind of leads to the next follow-up question that is what might be helpful in terms of preparing survivors and advocates before they testify or meet with legislators, if you just would like to answer that first as
Oh,
well.
absolutely. I've been doing that for a while. So yes, yeah, definitely help with that. I would say practice, 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 practice. Practice, by watching prior testimony on the issue that you're testifying about. In this case, FGMC, I tried to look at what other people had said, what they had presented in their testimony, what they had said, to the media, that kind of thing, to see kind of what people had done in the past. Anticipate what questions are going to come. And I think some of that will come from an understanding of the history of the legislation. The history of the legislation in Connecticut has been really, really interesting. How it was first brought up 6 years ago by people who were somewhat conservative, or actually, I should say, very conservative, but were bringing up a ban on FGMC for all the wrong reasons. And that really informed how we ended up, having, building this coalition of all kinds of people, to help bring about this change for the right reasons. So I think, understanding the history of that legislation and the legislators that have been involved in that process, that helped me understand how to communicate while I was testifying or doing education sessions or speaking to the media. Like that was very, very helpful. Um, I think also from a survivor perspective, you are going to repeat yourself hundreds and hundreds of times. And there are times where it will feel like nobody's listening, but they are. And I talk about this a lot, that like you're planting a seed. It takes a while for that seed to germinate and grow, but you're planting that seed, and it will come back eventually. And as I mentioned, I say a lot, one girl cut is one too many. And it was really gratifying to hear a legislator say that completely separately in a different forum. But she may not have realized where she heard it, but it stuck with her. And I think, that constant repetition, even though it can be tough for us who are testifying, is really, really helpful to really send that message. So, and as Renee mentioned, I had also done a Sahiyo Voices video, and that was used for the legislative process as well. And I think having those different multimedia ways of presenting what's done to different groups of people. I know somebody had talked about midwives and nurses, and I know in England, our group We Speak Out has spoken with police departments, and really having a very, very broad coalition that will support ending FGMC is really important, because there are so many connections in society that FGMC touches. So the more people you can bring in from all different walks of life, that is very, very helpful. And it helps to understand how big this issue is. It's not just the girl or the woman that is impacted. There are a lot of other people impacted. So to bring them in and talk about their perspective as well, I think that's helpful. And it helps me as a survivor, knowing that there are all these other people supporting as well.
Luna, is there anything you would like to add as well?
I agree with everything she said, because we need to be actually more than just at the legislative time. We need to be able to talk all the time with all the walks of life, because everybody gonna, when you have allies, they will show up and they will pass the message they heard from you. And I do the same thing. I use the video I did with Sahiyo to train providers. So my goal is to train every provider I see. OBGYN, usually they have a good idea, but the nurses, the social work, we now in Washington arguing about is this education needed for social work? They don't see where that fit, right? But we want to educate from the police, from the EMS, the doctors, the nurses, the clinicians, anybody who will come in contact with our community, because it's not only a health issue, it's a mental health issue, it's an image self-image issue. So it's bigger than just a cut. It affects the whole family, like Zara said. So I think we started and we're doing, but again, we have to have these allies and people who have the same mentality, because one person cannot reach the whole community. As we come together, I think we can make that happen. Thank you.
Thank you to the both of you for sharing your perspectives and experiences. We really appreciate it. We have one last question, and that is, what changes are needed to make, in your opinion, legislative spaces more accessible, respectful, and responsive? Renee, would you like to go first?
Yes, for a variety of reasons. When I spoke to the OBGYN residents, they arrived and left sporadically throughout the class. And I was told that this could happen because of their schedules, but I found it emotionally draining. And I hear that legislatures have done the same thing when survivors are advocating for justice. And so, in respect for these women, they should be required to be present and attentive, if that is at all possible.
Thank you, Renee. Izatu, do you have anything to share for this?
Yeah, so just to echo Zahra and Muna and what Renee just said. I believe legislative spaces need to be more trauma informed, as Zahra and Muna shared earlier, and accessible, respectful, and survivor centered. And how we can do this by preparing legislators and staff to engage survivors with empathy, attention, and respect. Also, important that we provide survivors with clear information about legislative procedures and realistic expectations too, so that we can reduce logistical barriers. Also, we make sure we provide travel support. Also scheduling and accessibility, and also restrictive limits on, testimony. Survivors should be able to, get all this information ahead of time, so that we can also creating opportunities for meaningful engagement just beyond public hearings. Yeah. So, yeah. So I believe those are super important in addition to what Zara and Mona shared earlier and what Renee just, the experience Renee just shared.
Thank you to all of you guys. That is the end of our discussion. We really appreciate you being able to share your perspectives and experiences with us today with policy advocacy. I'd like to now pass it over to Caitlin from the U.S. Network to End FGM.
Thank you so much, Kushi. And thank you to all of the phenomenal speakers that we had today on the panel. I think that was a incredible discussion to line up exactly why the Policy Advocacy Care Fund was established. So I'm really excited to talk about this fund. Some of you may have been on some of the previous webinars that we've had before where we've talked about this fund, and we've kind of been teasing it for a while now about how it's coming and we're launching it and we've been fundraising for it. But we're really excited to announce that it's officially launched as of today, where individuals are able to actually apply for funding now for this fund. So if you have not been on any of these previous webinars, I will just very quickly just provide like a brief overview about what the fund is. However, we are having this upcoming info session where we're going to go into much more detail. But everything that the panelists talked about earlier outlines exactly why we need a policy advocacy care fund, which is that survivors and activists have been leading this work to advocate for policy and systems change against FGMC this whole time. And this work has predominantly been done on a volunteer basis. And not just that, but as you all have heard, it has come with a lot of risk, particularly for survivors who face backlash from communities. It comes with a lot of emotional toll for sharing stories, for sharing their trauma and experiences. It takes a lot of time to sit at hearings all day long. It's expensive paying travel fees if you need childcare. It is a huge burden for survivors and activists to invest all of this time, all of this expertise, all of this emotional toll to commit to this policy advocacy that they have been committing this whole time and leading this movement for policy and systems change. And all of this work has not been funded. There has not been a fund or a grant or anything like that to date to support these survivors and activists on the front lines doing this work in the United States, especially. And so the US Network and Sahiyo came together and said, we really want to set something up to really support those who are doing this work, mostly unrecognized and certainly unsupported. And so that is what this fund is. And so this fund is specifically for individuals. It is for those who are on the panel today, for example, who are showing up to testify, who are submitting testimonies, who are sharing their experiences, and just supporting policy and systems change, specifically in the United States. Yeah, so we're really excited to officially launch it today. The application is open. But we are hosting this information session on October 8th at 1 p.m. Eastern Time. And this information session is going to specifically go into great detail about the eligibility for the fund, who is eligible for it, what type of activities are eligible for the fund. And all of that really, really important information. And so please register for this fund or for this information session if you think that this might be something that might be of interest to you. And the link, thank you, Mario, for putting the links in the chat there. So that is coming up. And then Mario also shared the link to the page as well that has more information about, including the link to apply, the link to register as well. And then if, say, you may or may not be interested in applying, but this is something that you are really passionate about and think is just a really important fund to have and would be interested in supporting it. We are also accepting donations as well to the fund as well so that we can continue growing it and supporting more and more people. And so on that page is also a link to continue to donate to the fund as well. So again, we can continue growing this fund and supporting even more people with it. And so, yeah, we're excited to officially launch it. And hope to see you all at the info session. And please reach out if you have any questions in the meantime.
I have a question. When is the application will be open?
It's a rolling application. We will be reviewing both the network and Sahiyo will be reviewing applications on a rolling basis.
Thank you.
Yeah.
Thank you, Caitlin. Would you like me to share the video that we had on the fund?
Oh, yes. Yes. Thank you so much. If you can play that. Well, Cushy is getting that up. I'll just introduce it. I shared a little bit of an overview about it, but we have this great video as well that just provides overview of the fund as well.
The FGMC Policy Advocate Care Fund provides vital support for U.S.-based survivors and allies. This includes financial assistance for transportation to hearings, grants for advocacy projects, and emergency funds for advocates at risk. The fund empowers individual advocates and community leaders in the U.S. to become effective voices for change, providing resources and support for their important work in shaping policies.
So much, Cushy. So yeah, hope to see you all at the info session. And I think, am I passing it back to you, Cushy?
Yes. Give me 1 second to get the slideshow back on.
Think we're at the end of our presentation today too, and Kushi is just trying to get up the slideshow for contact information if anybody would like to contact us or learn more as well. But thank you everybody for joining and being part of this webinar. And there will be a recording that is sent out. And if you have any questions, reach out. But Kushi, is there any other last words you'd like to share?
No, I think that covers it. Thank you, Mario. We'll add the links again in the chat for the report and all the info session information. Thank you again, everyone, for joining. Thank you. A huge thank you to our speakers today for sharing their experiences. Yeah, thank you.
I want to thank
Thank
everyone
you.
for joining us today. That was, it's really good to know that so many people are interested in supporting activists in this kind of work, because it does take a toll, and it was very much appreciated that there's so much support out there. So thank you.
Yeah, thank you, everyone. See you.
Yes. Thank you all.